Good afternoon.
What an ungodly hour.
This is I'm Cassingham.
Yay!
And this is Speaker's Corner.
And look, you got your audience.
I have an audience, which, there's so many things going on right now. I thought, Randy and I'll be talking to each other, which is common.
You talk to him.
And he doesn't listen, yeah.
He just
Correct.
says yes, deal.
No, he doesn't do that either.
Yeah, but that's marriage. So,
Yeah. So, as you may remember, I called us this Residence Corner last time, and this is part 2 of Residence Corner. We see the Odyssey community as a community, and we believe that communities support each other, help each other, etc.
That's part of the first video, actually.
Okay, so I'll quit talking.
You know what we didn't do is we didn't test the audio from the computer.
Oh, well, that'll...
Hopefully LT's ready to
LT
check
knows
that.
lots, so yeah, LT will do well. So this is show and tell with videos. There will be a CPR class next week, and I'll have a sign up here. This isn't certification. It's intended to give you enough confidence that if one of your fellow neighbors, residents, falls, gets sick, you can take action. And that's what we're going to go through today is what kind of action can you take. So I'll sit down. Oh. And here's the other speaker, Randy Cassingham.
Yay.
Hello, Mr. Taft.
All right, and I want to start with actually something I said off the cuff at our last presentation. I was actually kind of surprised at how much applause it got. And it's, to me, kind of the fundamental thing. And how do I get my... Oh, that is it.
Yeah.
So let me... So I can't see it on my computer. I can only see it on the screen. Let me get it back to the beginning. So here's where we are. That seconds count, but you can expect help in minutes. And so we think that survival counts on us. And we're residents, not passengers. We know each other. We have feelings for each other. And I think we should watch out for each other. So not only when somebody goes down, we need to watch out for them before they go down and keep them from going down.
The best way to help an emergency is to prevent it.
So you can't necessarily help somebody prevent a heart attack, but we can fix a lot of things before they happen. If you see a hazard, don't let somebody trip over it. Call attention to the hazard. So, are we ready to go on to video 2, Kid? You have the schedule.
Yeah, I do. Let me turn my microphone back up. Yeah, we are. So, when you see somebody go down, one way you jump into action is to call out. Now, how do you recommend calling for help?
Yep. Calling help. Just help.
You could direct somebody to go to the telephone and call the front desk or 911.
And if it's a true emergency, go straight for 911. Don't run to the desk if there's a phone closer. There's a phone right there in the bar. You don't need to run to the desk from here.
And that's presuming you're in this room when
Right.
somebody falls. There are phones, I believe, near every elevator.
In every elevator, near every elevator.
Okay.
There's one in the business center.
Of course, the front desk has several.
There's also people there.
And when you see somebody go down, part of the action is direct. Judy, go get the AED, get it and come back. I always remind people to come back because sometimes in their excitement, they have the AED and they're going to stand there, hold it. You want them to come back and give it to you. But be decisive. Take action. Use your voice. And if nobody else is around, keep calling for help as you drop to your knees to do CPR. If they aren't talking, they're not responsive, and especially if they're not breathing. So Randy, do you have, see, is this time for another video?
Yep.
So this Australian video, training video that Randy's going to show you models the AEDs that we have, the life packs.
It's the exact same model that we have.
So watch carefully, and this is going to be a stop and go. So Randy's going to stop and point and let you see if you can find the error in the action you just saw. And then he'll continue. And I want to point out that these are actors, and they've been trained how to do this, but they are actors, they're not EMTs. So,
well, bottom line is they're regular people like you guys. So, but I figure since it's a training video, they really should do it right. And there's some things that they don't do right that I'm going to point out, just so that you're watching and kind of clued into what's going on here. You got to watch what's going on, and there's some things that aren't quite right. And I'm going to stop the video here and there and point those out.
A couple of notes I'll make before he starts is that breaths are not required for the CPR we're teaching. We're teaching compressions only. Man down. Okay.
Okay, so we should be ready. So we're in a warehouse. We got a guy on the floor and a couple people showing up. And I like that his clipboard's in midair because he just dropped it.
James! James, are you okay?
Check the patient's response to talk and touch.
James. James.
Touch or tap the patient's cheek and ask if they're okay.
James, are you okay?
If no response, call 000 ambulance.
Smith, call 000 and get the defib.
The CR2 is one of the easiest defibrillators to
What happened to her
operate
phone?
and will assist and guide you through the rescue.
James.
Continuity problem.
So what's he doing wrong? He's already decided he needs an AED. If you've decided you need an AED, you start CPR right now. Compressions are key. So what helps people survive a cardiac arrest is one, that you witness it and you see it and you take action immediately. And what's the action? That's number 2, start compressions. Don't worry about breaths. Start compressions.
Should he be removing any of the outer clothing?
Ideally, yes.
Okay.
And not just outer clothing. You basically want a bare chest.
Bare the chest, yeah.
Right, okay.
Should you be checking to see if he has a pulse?
The average citizen doesn't really know how to do that. If they're not responsive, not breathing, they need CPR.
Okay, good answer. And let's continue on.
The defibrillator will start automatically when you open the lid, and you can toggle between adult mode or child depending on the patient.
Adult mode.
Notice this talking to.
Remove all clothing from patient's chest.
So they have a pair of scissors, which makes it a lot easier to get a bare chest.
Pull red handle to...
Which, I'll point out, don't wear your nice clothes when you're going to collapse with a heart attack, because they'll be ruined.
God, I felt so bad cutting off a woman's gorgeous jacket once.
Leather
Just
jacket
terrible.
was...
So there's still something wrong. They bared his chest, but they didn't get this collar. And you need to get the pad way up here. It's going to be in the way, and you'll notice.
Reveal pads. Look at
So
pictures
you
on
peel
pads.
off the cover, and then
Apply
you
pads
peel
to
off
bare
the
skin
pad.
exactly as shown in the pictures.
The CR2
And they're
has
very
an inbuilt
sticky.
metronome and provides real-time CPR feedback to ensure even untrained rescuers provide the best possible assistance to the patient.
Should he be doing CPR while she's doing this?
You know, ideally, the answer is yes.
But he didn't start CPR, so why continue it?
Yeah. Okay.
Right. So he should have started CPR, and you know when Kit and I did the cardiac arrest that resulted in this tattoo, I sent her in because we knew CPR was in progress because that's what dispatch told us, and so I said, you go in and take over. Whoever's doing it is going to be tired, and relieve them while I get all the stuff together. And then when I got in there, sure enough, she was on the floor doing compressions. And I got the defibrillator out, and as I pulled out the patches, she just leaned over and kept pumping.
Right.
And I slapped that one on, and then she leaned over the other way, and I slapped that one on. That's ideal.
Got it.
We practice that, we do it all the time,
We'll be doing that in the CPR class.
and it's
Hazel,
hard.
can you
it's-
hold questions? Make notes?
Unless it pertains right now to this. Okay.
Okay.
So you don't want to put the patch over a pacemaker, and you don't want to put it over a nipple, which is what she's about to do.
Press pads firmly. Do not touch patient. Analyzing heart rhythm. Provide chest compressions to the beat.
And I think that there might have been something cut there, because don't touch, start compressions. Probably not really perfectly done. But and notice the metronome, that's the AED is making that tick.
Push down hard at least 5 centimeters.
So what I wanted
The
to
CR2
what I wanted to point out here was that this is a real person. He's not really having a heart attack. So they're doing a very light compression. I've got another video that shows what it's really supposed to look like. All right.
And if you don't have a metronome in your
will
AED,
analyse if a shock is required. When a shock is needed, the CR2 will
We'll get to
advise
what Kit
everyone
was
to
saying.
stand clear.
Stop chest
And we're
compressions.
back.
Everyone clear. Do not touch patient.
And that's what we
Delivering
want, your
shock.
hands up like that.
Shock delivered.
Right back
Resume
to
chest
CPR.
compressions.
Continue providing
There you
CPR
go.
until either the patient regains consciousness or emergency services arrive.
if you know the song Staying Alive, have that running through your head, because that's the beat you want to keep
The Bee
compressing.
Gees. And, medics with their sixth sense of humor, we use another one bites the dust.
It's the same beat, it works.
It's 100.
Don't say it
it's
out
100 a
loud.
minit.
Don't say it out loud, though.
You can do happy birthday as well.
Ah.
Happy birthday.
to me.
It's Hazel's birthday, we'll celebrate later, okay.
All right, so let's
It works though.
but let's do it again without all these interruptions.
The LifePak CR2 is the latest and most technologically advanced defibrillator on the market. This AED brings you one step closer to saving the life of a friend, family member or colleague. The LifePak CR2 is simple and easy to use, even by an untrained bystander. Within 3 minutes of someone suffering a cardiac arrest, and with access to the CR2, survival chances may increase from 4% to 74%. For further information on the LifePak CR2 defibrillator and to see how simple the device is to use, keep watching. It may just save a life. The LifePak CR2 features an audible metronome, guidance and coaching for CPR, intelligent CPR insight analysis technology, an inbuilt child button, easy to apply electrodes, and Wi-Fi connectivity. The CR2 will alert you via email if it requires maintenance.
Just go back and press that. James! James! James, are you okay?
Check the patient's response to talk and touch.
James. James.
Touch or tap the patient's cheek and ask if they're okay.
James, are you okay?
If no response, call 000 ambulance.
Smith, call 000 and get the defib.
The CR2 is one of the easiest defibrillators to operate and will assist and guide you through the rescue.
James.
The defibrillator will start automatically when you open the lid, and you can toggle between adult mode or child depending on the patient.
Adult mode.
The scissors are in that little pouch,
Remove all clothing from patient's chest.
which we don't have.
Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin exactly as shown in the pictures.
The CR2 has an inbuilt metronome and provides real-time CPR feedback to ensure even untrained rescuers provide the best possible assistance to the patient.
Press pads firmly. Do not touch patient. Analyzing heart rhythm. Provide chest compressions to the beat. Push down hard at least 5 centimeters.
The CR2 will analyse if a shock is required. When a shock is needed, the CR2 will advise everyone to stand clear.
Stop chest compressions.
Back.
Everyone clear. Do not touch patient. Delivering shock. Shock delivered. Resume chest compressions.
Continue providing CPR until either the patient regains consciousness or emergency services arrive.
The depth of your compression should be 2 inches for those of you who don't know centimeters.
Here we will show you how to change the batteries and pads of a LifePak CR2
And
defibrillator.
I just thought this was interesting.
To
because of
replace the
what happens
pads, first
partway
open
in.
the lid of the defibrillator. Hold the off button down to turn off the device. Lift out the used or expired pads pack and dispose of it. Inspect the new pad pack seal and expiry date. Close the lid of the device. The new pad pack is ready for use. Turn the defibrillator over and open the back lid of the device.
This is the
You
part.
can store a spare pad pack in the back of the device.
And I don't know if we have a spare set of pads in the back or not.
To change the battery, press the locking tab on the battery and remove from the device. Check the manufacture date on the new battery and click into place. Close the back lid of the defibrillator and turn the device over to the front. Allow up to 2 minutes for the defibrillator to self-test. Open the lid to ensure the device is working correctly and then place back in your defibrillator cabinet. To ensure your defibrillator is working, once a month simply check the light is flashing and you can rest easy knowing your device is ready to go.
Okay, and that light is right here. And I have looked at the one that's in the cabinet over the desk, and yes, it flashes about once a minute, or every 30 seconds, something like that. It's not constant flashing, but it's just telling you, yeah, the battery is working. And if it's flashing red, you ever notice it's flashing red, call it out, because that means the battery needs replacing. You don't need to replace the battery just because you used it once. Those batteries usually have a lot of charge, especially if you don't have to shock somebody, 10 times, because it'll tell you to shock him every 2 minutes if the heart is in a place to be shocked. So, what's next, Kit?
Okay, if I follow our notes here, we're done with the AED videos.
No, we have one more video.
Okay, then is this the official training video for the AED?
Yeah, so this is the manufacturer's video, and they use a dummy, which the nice thing about the dummy is you can see just how deep it really is. What he was doing was basically trying not to hurt the guy who was lying on the floor. I like the way he was wearing a stocking cap too, so they could put a pillow back there. It was very, very thoughtful, because it's really not comfortable to be lying on a floor like that as a patient and not being able to move. So let's get that one going. And I think ours does not have the carry case.
Adult mode. Remove all clothing from patient's chest.
So, and there is a button for child mode. Can kids actually need a defibrillator? Absolutely, especially when they're in sports. Because when they're doing really strenuous activities, that helps reveal that they've got some kind of congenital problem. And damn it, they drop dead on basketball courts and football fields all the time. It's really sad.
And we don't like it when they do that.
No, and a defibrillator can save them.
Pull red handle to reveal pads. Look at pictures on pads. Apply pads to bare skin exactly as shown in the pictures. Press pads firmly. Do not touch patient. Analyzing heart rhythm. Everyone clear. Do not touch patient. Delivering shock. Shock delivered.
Dummies don't jump.
Provide chest compressions to the beat.
Now look how
The
deep
heel
this
of
is.
one hand should be in center of chest. The other hand should be on top of first hand. Push down hard, at least 2 inches. Provide 2 breaths. 1.
And we're going to
2.
skip breaths.
Resume chest.
So she's not perfectly in sync with the metronome, but that's okay. We're not going to do breaths because you don't really need to. We're going to have the medical team here within about 5 minutes. And we can really get them ahead of the game by doing compressions. The guy Kit and I saved went 11 minutes without any ventilations at all, and he's 100% fine.
He had very good compressions, and that keeps the blood going, and there's oxygen in the blood, so there's oxygen where it needs to be.
And you're getting a little air exchange because you're pressing on their chest.
Yep. Positive and negative pressure.
Are you still right on the sternum?
Yep,
Yep.
right between the nipples on the sternum.
And you want to be right in the middle of the sternum.
Right.
You don't want to be too far down.
Right, you're breaking.
Yeah.
You're gonna break stuff anyway, probably. But
Well,
all right.
and sometimes when you're doing compressions, especially the first ones, you'll feel like you're breaking ribs. You probably aren't. You're probably loosening cartilage.
Well, that's good.
So, but even if you do break a rib, it's better to have a broken rib than be dead.
Okay.
Compressions. Push down hard, at least 2 inches. Provide 2 breaths. 1. 2. Resume chest compressions.
So it talks you
Push
through the
down
whole
hard,
thing.
at least 2 inches. Provide 2 breaths. 1. 2. Resume chest compressions. Push down hard, at least 2 inches. Provide 2 breaths. 1.
You can see why you get exhausted doing
2.
this.
Resume chest compressions. Push down hard,
And she's
at
putting her
least
body
2
weight into
inches.
it. She's not using her arms to do this. She's using her body weight to help.
Provide 2 breaths. 1. 2. Resume chest compressions. Push down hard, at least 2 inches. Stop chest compressions. Do not touch patient. Analyzing heart rhythm. Everyone clear. Do not touch patient.
Including your knees.
Delivering shock. Shock delivered. Resume chest compressions. Push down hard, at least 2 inches.
It says, continue to follow the voice prompts and provide chest compressions until one of the following occurs. Patient begins breathing or moving, emergency personnel arrive. That last thing, when emergency personnel arrive, don't stop then. They need to get things together too. They've got all their stuff in bags. They need to get resuscitators out. They need to get drugs out. They might want to use their own monitor, defibrillator. So please keep going. Do switch off at least every 2 minutes. You know, what we do in the field is there's a shock every 2 minutes if it's indicated. We switch off when it's doing its analysis. There's that little bit of time where you're not supposed to touch the patient anyway, so we can get a good electrical reading. That's when we swap.
Okay,
Yeah.
and we'll go over all this more on our class.
Yep. But I want you to get the basics just from this anyway. What's next, Kitty?
Next is choking. And I don't mean when I choke Randy at night. I mean when people get food stuck in their throat or something stuck
But
in
save me from that anyway.
Yeah, if I start doing that to him, please come in and help him.
All right.
So, Heimlich maneuver. Yes, Charlie?
Before leaving the life pad, one question, and I think you alluded to the answer, Randy, but
Hold on. If you're going to ask a question, I need to give you one. Can it wait?
it can certainly wait, but
Go.
it pertains to life pack, and I thought before leaving.
Go.
Close.
So,
Up front.
so the video, if I recall correctly, said that do not touch patient after you applied the pads. And perhaps you could explain why you want to stop chest compressions if indeed you were doing them before.
Right. So ideally, you're doing compressions while you're putting the pads on for the defibrillator. But when it tells you don't touch patient, what it's trying to do is check the heart rhythm. You can't just shock anything. It has to be the right kind of rhythm.
It's analyzing the body, the person.
I mean, the right kind of rhythm is the wrong kind of rhythm to live, but it's the kind of rhythm that it needs to shock. And it's checking for that. And if you're jostling the patient around or touching them and therefore kind of
Influencing.
inducing your own heart rhythm onto the patient, especially if you touch the pads, it can not get a correct reading. So it needs to be able to see what's going on, and that's why it doesn't want you to touch.
And you don't want to touch while it's shocking because you get to have the shock too. And you don't want that. Can it wait? Okay. But remember I'll get you the microphone. Okay.
Okay, so we're going to go on to choking, which frankly is probably more likely to happen on the ship. We've had 2 cases already
That we know of.
that we know of where people were choking and they could have been in serious trouble if people didn't step in. Thank you, Chris. I see you back there. And help that person survive.
And I had to do, it wasn't Heimlich, but Randy got a
vitamin capsule.
Vitamin capsule stuck in his throat. And it was really uncomfortable, so I was doing the back thrust.
So
the capsule came apart, and when one of my pushes, the powder came out, and it gave the table quite the show.
So what she did though was she asked me, do I need to do the Heimlich? And I shook my head no, because I was coughing, I was breathing, but it was stuck there and it was very uncomfortable, and it was particularly uncomfortable when it dumped ascorbic acid down my throat. But she said, do you want me to give you some back slaps? And I said yes. So that's when she came around. Kit is a pretty strong woman. She was not doing them hard enough.
Well, and part of it is because the chair's in thistle. I would have had to move him, and they're not designed for short people doing tall people activities. But.
And you kind of want to bend them over a little bit anyway, so that if you knock out whatever it is in their throat, it comes out of their mouth instead of going back in.
Yeah.
But let's look at this cool video that I found on choking. So this 17-year-old kid saved somebody's life, and here's his story.
I'm scooping ice cream, and all of a sudden someone from behind me just yells, "Is there a doctor in here?"
Jacob turned and saw a customer choking.
And I just reacted. I didn't really think about it, and I just ran right over there.
Jacob then performed a procedure he learned in lifeguard training, something known as the abdominal thrust, or more commonly, the Heimlich maneuver, which can save someone from choking.
I was able to actually get right under his ribs and do like a good thrust that he was able to cough up his food in the first thrust that I did.
The Heimlich maneuver was made famous by Dr. Henry Heimlich more than 40 years ago. It is one of several first aid options used when someone is choking.
In the grand scheme of medical procedures, this one's incredibly safe.
Dr. Kyle Staller is a gastroenterologist at Boston's Massachusetts General Hospital. He says it's important to know the Heimlich maneuver because in a choking situation, minutes count.
And we know that when someone's deprived of oxygen for 4 minutes, that brain damage can start to occur.
You want to locate their navel and make a fist, put it right above the navel.
Susan Mastandrea teaches the procedure to YMCA lifeguards.
You want to put the other hand on top of that fist, and you want to do strong inward and upward thrust like that.
Jacob Vieira was one of her students.
You feel a little nauseous?
Yeah. Dr. Staller recommends 5 to 10 thrusts at a time, treating each one as an independent effort to clear the airway.
Basically what you're doing is you're taking air that's trapped in their lungs and you're forcing it to be expelled out at a high rate of speed and a high pressure.
It's important to use airway clearing procedures like the Heimlich only when needed, and Dr. Staller says there are key signs someone may be choking.
When they're unable to cough, when they're unable to speak, and the universal sign for choking is this maneuver, right? Putting your hands around your neck. And you ask, and you say, are you choking? And they will nod. That's the time when you need to spring into action.
Fortunately, Jacob Vieira recognized those signs with that restaurant customer.
He had his hands around his neck, his face was very red.
And saved his life.
Everyone in the restaurant was clapping. And for me, it was just such an adrenaline rush, and I was very humbled by it.
So I didn't get my cursor down there in time to get those questions. So let's see, what was question number 1?
Back slaps.
Oh yeah, what about back slaps? Yes. The advice varies depending on who you ask. I think in Australia they go for back slaps first. I tend to go to Heimlich first, but would you stand up? So, you want to find the navel, there it is, and get right in there and cover your hand with the other, and then you're doing back and up. You want to just push on their lungs, basically, to put positive pressure in there to get something behind whatever's trapped in there. So what happens if kid's pregnant? My God. Yeah.
Miracles happen all the time.
Or if it's somebody that's you're a small person.
I'm really big.
And we've got a big patient, and you just can't get your arms around there. That's when you go to the sternum and do basically the same thing. Just right in the middle, and you can do a chest compression like that. And if they collapse, they suggest start CPR, which is just chest compressions again. And it's the same idea. You can move air by doing chest compressions. And let's see.
You have drownings in babies. Did you want to say something?
Yes.
For babies to do back slaps.
Hold on just a minute, because we're not quite there yet.
Oh, okay.
So back slaps I just covered.
You've got a slide for
Oh, and the other thing, I did this. So the other thing to do is get them to bend over a little bit and give them some good whacks right between the shoulder blades. And I know I have another question in here. This was actually a thing that, what about in drownings? Heimlich himself suggested the maneuver for drowning victims, even asthma patients. He was way overclaiming the effectiveness of what he came up with. Works great for choking, does not work in drownings, does not work in asthma. And what about babies? So that's where Kit was. So I actually have some.
Since we don't have babies on board very often, if at all, can we skip this part?
I want to do. It's very brief. It's not even a video. It's just a loop. So the second time she hits it a little bit harder, and what I wanted to get to was, you can't read this because it's so small. Even if I zoom it in, you're not going to be able to read it. But it says every time we post a choking first aid video, this question comes up, and this person says, "Aren't those blows too hard? Babies are so fragile." And here's their response: bruises can heal. A baby with no oxygen for 4 minutes can't. And yeah, this kid has quite some impact. They should be higher. They shouldn't be down this low. But whoever did that saved this baby. And you'd much rather save the baby.
And heal the bruise.
Yeah.
So when I was talking about Randy and me doing this session, there are a couple things he asked me to specifically cover. One is a code Oscar. A few of those of us who've been on for a while know about that. Who knows what a code Oscar is? Show of hands. Man overboard.
Before you get to that,
Yeah?
can I go back to choking for just a moment? Or do you not touch it?
Can you hold it? Because I want to make sure we do get everything covered before we
Okay,
do.
just something I want everyone to use.
So Judy has some and you have some. Okay. Code Oscar is man overboard. And just for, how many of you have had water safety classes? Trained to be a lifeguard? Okay, only a few people. The same lessons you got there apply to man overboard. When you see somebody go over, you keep an eye on them. Throw them the ring as you're calling out to get more help. Send people to the phone for help, and keep screaming, keep watching them. Do not take your eyes off of them. And
if you're toward the front of the ship, start walking back so you can keep an eye on them and look out the back toward them.
So that is something that's real important, and I know that the crew trains for that periodically, and Kelly could probably tell us about it, but we'll let her do that in Q&A later. But it's something that we hope you never have to practice, but keep your eye on them, send them the life ring, call for help, and keep calling, scream, holler. You'll get people's attention.
Yep.
There's enough people walking the deck 5, which is probably where somebody would go off, that you'll get the help you need. So. And I want to get to the Q&A session, so, do not go in after them. It's not healthy for you. Now we'll have 2 drowning people. And the water's cold. You don't need that, so. So other issues that we have. We've had a seizure. I know we've had 1 seizure on board.
At least.
At least. Yeah, well, I know of 1. There probably have been more. Do not put anything in their mouth, especially your finger. I know in the olden days they told you to put a stick or a spoon or something. No, don't. It doesn't help anything. Create space for them. Pull them out if they're in a tight area or if they're in broken glass. Get them into a safe location and let their body just do what it's going to do during the seizure. And it's hard because you want to help. The way you help is to give them space. And call for help.
And maybe pad their head so they don't pound their head on the floor. But
yeah, the seizure we had was in Palms.
Now we see you. We'll get to you shortly.
And we were having lunch or dinner, whatever it was, with Claude. So it was Claude, Randy, and me. Somebody came over to get Claude, so the 3 of us rose in unison, went over. We pulled this guy out from behind the beverage stand, and Randy and Claude were getting him turned. Recovery position is something you need to know. Left side. Because if they're going to throw up or have a problem, that'll go out and not be aspirated back into their lungs. And I had my foot under his head, and somebody came up to me and said, "Make way for the doctors. Give him space." I said, "He is a doctor," and I kept my foot there. Turns out I was talking to the captain.
But he recognized we knew what we were doing, and he backed off.
He gave us space, and when the medical team arrived, we let them take over, and we gave them the handoff notes. And, so seizures, falls. You guys quit falling down. You hurt yourself. Sometimes people bleed when they fall down, or they get cuts. Real quickly, I'll just say, put the bleeding part over the heart. That will help reduce.
If practical.
Yeah, if practical, and that it reduces the pressure and reduces the flow. Hopefully without direct skin contact, put pressure on the wound and press real hard and keep that going till medical. And every time there's a medical emergency, call for help. People may not notice that you're doing a Heimlich. I think when Chris did the Heimlich, nobody came to help him or check on the patient. Okay, in 10 minutes he could have been dead. So, and I did mention to one of the crew, it may have been captain at the time, that the staff didn't jump to enough, and so I know that training is much more effective now at saying, if you see a resident having problems, do something. Was it Katoot?
I think so.
At Thistle one day, somebody fell. She knew she was going to, and so she just kind of sat on her backside, and Katoot was right there to help make sure she was okay. She was fine.
I heard her fall, and I knew what it was instantly. I jumped up, and by the time I could just turn around, Katoot was almost there, because he saw it and jumped on it immediately.
Yeah.
Just the way he's supposed to. I made sure that the dining room manager knew that he did the right thing and jumped into it immediately. She wasn't hurt. It was okay. Food went everywhere, but that's okay. Blood didn't go everywhere.
And she didn't break anything. So.
Yeah.
There's enough diabetes on board that we need to be attentive to people having a diabetic episode. If you see somebody wobbling a little more than normal, not behaving right, ask them if they're okay. And they may not know that they're not okay. They need some kind of sucrose. So a sugar pill, a little bit of, if they're conscious, you can give them some sugar water or something. If they're unconscious, give them juice. But if they're unconscious, you can't give them anything, because unless you have a tube of icing in your pocket, it will choke them. But call for help. People will jump to help with that. Strokes, I don't know. Call for help and put them in a recovery position.
Can't do much for them.
Can't do much for them.
All right, let's go to Q&A.
Yeah, all right. So we've got wait for microphones. Basha and I will deal with that.
Mine is not a question, but I think I mentioned this to you guys last time. I have a condition, a strange one, where something will trigger my throat to spasm. And it could be just a piece of phlegm, it could be hot, spicy something, I never know what it is. And I will be gasping for breath and panicking. And I don't think there's really anything anyone can do about it. I think I just have to, you have to wait it out, but it's going to look and sound horrible, and you're all going to be thinking I'm dying. But the Heimlich maneuver, I think,
won't help.
No.
But somebody could at least keep an eye on you and make sure you stay okay as you.
It sounded really horrible when I got the capsule stuck in my throat.
Similar. Very similar.
No one in the dining room came running over. Not a single employee.
Yeah.
Well, because I was there probably, but.
Yeah, that was part of it. But yeah, if they're choking, they're coughing, that means they're breathing.
Yeah, and I'm not breathing at that point. Well, I am that.
That's exactly what I was doing.
Okay, yeah, and I also get big pills stuck in my throat, so that might be another thing. Okay, thank you.
All right, we got a question here, and Hazel, I know you want something to have a question. Oh, she'll come.
Okay, back in your AED demonstration of videos, we had the patient on their back, but they don't always fall and land on their back.
Good point.
In terms of turning over, and you just mentioned about somebody in the restaurant and putting them on their left side, but that wouldn't work for AED, I assume.
Right.
But what should we do if they have fallen face down? Do we turn them?
Yeah, you roll them over.
You work with it.
Well, sometimes you put pads front and back. You want the heart between the two pads, be that here, here, or here.
Yeah, especially for kids, it's called anterior posterior AP, and you put one basically here and the other one on their back. Because kids are kind of small, and it's kind of hard to get those two pads in a place where the heart's somewhere in between. But in general, you want them on your back, because if you're going to be doing compressions, you want them on a hard surface, not on a bed.
The other thing which I was wanting to mention, when they've opened up, they expose the chest, you can always put your hand on the chest to see or feel if there is a heartbeat. Because when we're saying, you know, a lot of people don't know how, you know, where to look for and for the pulse. That's another one where you put your hand on, you know. And also the other thing is, with you saying about your choking or something like that, don't be afraid to thump the table and draw attention to yourself.
Yes.
You know, don't just struggle. Bang, you know, let people know you're having a
Throw a plate on the floor.
Yeah.
You know,
That would be
it makes a lot of noise.
Yeah.
And the way I find out if somebody's responsive is I use my knuckles and I rasp them right on the sternum, and it's very uncomfortable. If somebody is actually conscious, have somebody else do it.
Give them a
Yeah, if you do it to yourself, you don't really feel it.
You don't just hardly.
But
remember the noogies you gave to each other as kids?
Yeah, but if you wrap your knuckle, you know, rub your knuckles on their sternum and you're pressing fairly hard, if they're awake, they will respond. Trust me. And when they're truly unconscious, they will not respond.
So my question is going back to the seizures, and so if you ever see someone maybe going to have a seizure, do you want to like make a comfortable spot on the floor or on the couch and always have them sideways? Don't ever have them on the back, is that correct?
Ideally on their side, yeah.
Okay.
And sometimes people will say, "Uh-oh, I'm going to have a seizure."
Yeah.
Because they get whatever
not a first time
visible things that they're aware of. Okay. And yeah, I think it's a great idea to help them down to the floor.
It's really thoughtful.
Yeah.
I personally get this vagal response. And the vagus nerve is the main nerve that comes down. And if I get something stuck in my throat, like a vitamin, sometimes I will realize I'm in trouble. I'm going down. I will literally get out of the chair and get on the floor because I don't want to fall onto the floor. And Kit saw that once, and I woke up to her being on the phone to 911. But it was just the right thing to do. I mean, just because you're an EMT doesn't mean you don't call 911.
And then I called the person I thought was on the ambulance that night and told her what was going on. So they arrived laughing. It's good to have friends.
Well, they always laugh at you when you're a medic anyway. Anybody else? Yep.
Yeah, Chris has one.
So,
yeah, you're good.
We don't always choke when we're in public with other people. I know they used to teach us self-Heimlich.
Yes.
Do you guys want to talk about that?
Yeah, good point. Especially with the high dining room chairs that we have, that's really good. I'm so dang tall that it'd be hard for me to do it. But you know, the chair, you can just kind of get the chair in here and just lean into it. You can actually do it with yourself, with your fist. It's a lot harder because you really need to get a good thrust going. But yeah, you can do a Heimlich on yourself, and the usual thing is a chair or a high table, and get in there and give it a good shove.
And Chris, I'd like to tell you, just be sure to always choke in public.
Yeah. But good point, Chris. Thank you.
Oh, hold on, we've got one here first.
Okay, so I'm a member of the Sudden Cardiac Arrest Survivors Group,
Hey.
Foundation. I was in surgery, and the anesthesiologist did not read my records, gave me 2 drugs I was allergic to, and stopped my heart, complete asystole, for 8.5 minutes. 3 doctors did CPR on me, and they did it at 220 beats per minute. Doctors do not do this every day. They do not know how to do it. They took a 1-hour class in med school. If you have a choice between a doctor or an EMT, pick an EMT every time.
Yeah, we've done CPR a lot of times.
Yeah, so here are some stats that people may not be aware of. If you arrest, and 70% of people that arrest in their home or in their office, they're not in the medical setting. They have an 8% chance of survival. If you're in a medical setting, you have a 12% chance of survival. And basically it's 1 in 10 will survive this. And in the US, what we call survival means that you make it to discharge out of the hospital. 37% of those people will die within the first year. Only 41% are alive at year 3. So do we need more AEDs on board? Well, survival jumps from 10% to 60 to 70% if you can get an AED and CPR started within 3 to 5 minutes. Now, here's the question. Can you get to where we have an AED on this ship and get back within 3 to 5 minutes? I couldn't do it. I have a problem with stairs. I'm not waiting for an elevator. Can you get back in that short time? I think we need to have an AED on every deck, and it needs to be in a standardized place where everyone knows where it is.
Here.
And just because you saved someone, I can tell you that my vagus nerve was fried. After I went through that, because when you're doing 220 beats per minute, the heart or the blood does not circulate. It's next to useless other than cracking your ribs, and they did a great job of that. It affected my heartbeat. I would forget to stop breathing, or I would forget to breathe. And the only reason I would know I was not breathing is all of a sudden I'd go, because my body would kick in at some point. I now have chronic gastritis and mixed IBS. It messed up my entire digestive system. I have brain damage. Most people don't know it because I can hide it pretty well. But my IQ went from 143 to 117. I could no longer do the job that I used to do for the U.S. government. And I was a senior executive. I did some pretty cool stuff for the American people. My short-term memory is gone. I will take my pills in the morning and 5 minutes later say, did I take my pills today? I can't remember. There's no short-term memory left. I don't remember much of raising my kids. That kind of memory is gone. I become overwhelmed pretty easily. I can no longer multitask, and I used to tell anyone who wanted to hire me, give me 10 things to do and I'll do 12 for you. Give me 2 things to do and I might do 1, but I used to be able to multitask. I no longer can. I have a black hole in my brain where thoughts go to die, and I cannot recall them. And it's not that I forget them, it's just they are not there. The brain has been so severely impacted. And what was my husband hates this, but as soon as I came out of it and I was in the ICU, I had a rage that I had never known before, and I mean a scorch the earth, everybody's got to die rage. I don't know where it came from. I don't know why I have it. I'm trying really hard to mitigate that because he really doesn't like it. I no longer can regulate my body temperature. I have hot spells that make menopause look like a walk in the park. And I have what I call cold spells, that it's like my bones are ice and I cannot heat myself up. Go sit in a hot tub, take a hot shower, a million blankets. I can't get warm until my body decides to stop doing what it's doing. So it's...
All this from the anesthesiologist.
Who didn't read my records. And I did talk to her about five months later, and she said, but I saved your life. And I said, yeah, that was after you killed me.
Yeah.
It's been rough, and I gotta tell you, I was suicidal every day for 2 years afterward. I didn't want to die, but I did not want to live in this body anymore.
Yeah,
it had been changed so radically.
You really need to do it right, and we need to move on, but thank you for that information.
It's rough. Being on the other end is rough.
Yep.
And the one thing that saved me was not the doctors, but it was my husband. It's the only thing that kept me here.
Can you pass your microphone to Whitney? And
we've got
we get another one in the meantime. Go ahead, Charlie.
Please elaborate regarding the Heimlich. Decades ago, when I was taught the Heimlich, that was one forceful compression. Video referenced 5 to 10.
Yeah, usually one will do it, and if one doesn't, you know, the second or third one will. And if that doesn't, I then switch to back flaps. And then if that doesn't do it, go back to compressions. Sometimes you just can't get it without forceps and a laryngoscope, but yeah, you do what you can.
Brittany?
Randy, I think I heard you say something about a pacemaker and where not to put the pad.
Yeah, one of the reasons you want to bare the chest is to get the pads on, but the other thing is you can see what's going on. Like if they have a pacemaker, you ideally do not want to put the pad over the pacemaker because it's a chunk of metal in between the pads, and that's not ideal.
But you can still use the AED on somebody with a pacemaker.
Yes, because if they're in cardiac arrest, they're going to die unless you do something.
And I've never seen one before. Is it just lumpy? Like how would I know?
Yes, it's.
You can see the outline of it under the skin.
There's a disc-shaped thing that's pushing out. Looks like it's pushing against the skin. It's very interesting. You know it when you see it.
Randy, we have a comment here.
Can the pads go on either? Or does it have to be over the heart, and so the right side and the left side can't be here? I'm thinking about the pacemaker. The pacemaker's here.
Well, you just, if the pacemaker is here, you lower it. I mean.
Okay, but you want the left of the upper chest and the right of the side, or does it matter?
That's the ideal.
Okay.
Yeah.
All right. Okay. Thank you.
Any other?
Pads to be sort of on 2 sides.
Sherry's saying you want the pads to be on 2 sides. You want to have space, and it goes through the heart.
So yeah, it's up here and down here.
So if your heart's here,
and the heart's kind of in the middle.
Yeah.